Good evening, good afternoon, and good morning. This is the 1799th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Huang Wei Liang from Brazil. Let's begin the session with the 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. And we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. And from 8:30 to 9:30, we have the international session in English. And from 9:30 to 10:30, we have a local language session. And we are uploading the videos of the same on the very next day itself so that those who missed the session can watch it again and subscribe the same without paying any money. And we are very happy to announce that we are about to celebrate the 1800th day on tomorrow by participants from 12 countries will be attending the session, and hope all of you will be with us tomorrow at the same time also. And another big announcement is that we are about to celebrate the fifth year anniversary of International Forum for Promoting Homeopathy on September 28th of this year. That is just 2 months away from now. And we are conducting a lot of discussions, a lot of seminars, a lot of interactive sessions with the doctors, eminent personalities from different part of the world. And we can have a one-to-one meeting there in Cochin. That is the that is at the Taj Hotel, Cochin, which is one of the biggest hotel in Kerala. That is from Taj, as you all know, that it's a five-star hotel, and where we will be meeting one another and another. And the fees is fixed. There is that the rupees 3,000 per head for that evening. And if you somebody is coming out with you with companion, you can have it uh, the same thing with the 2,500 for that other companion too. So all in all, you will have to pay 5,200, 5,500 for that. Anyway, this is all about the news, and there will be.
I don't know if I can begin my presentation. Can you hear me? I don't know if the internet is working because Dr. Danesh disappeared suddenly. Okay, I will try to share my screen and see if
Yes, we can see. Unfortunately, there was a problem with my network, and I was left the scene. Anyway, we proudly welcome the guest of the day, Dr. Huang Wei Liang. And today, doctor is talking on are the antiseptic, antilipidemic drugs prescribed to reduce the chance of having myocardial infarction, increasing the possibility of having myocardial infarction nowadays. So, we you can begin the session, madam. Yes.
Okay, thank you, Dr. Danesh. You disappeared suddenly. I do not know if I can begin my
Okay, we can.
presentation.
It's very clear.
Okay. Thank you for inviting me today to this conference to share this study titled The Antilipidemic Drugs Prescribed to Reduce the Chance to Have Myocardial Infarction, Increasing the Possibility to Have Myocardial Infarction Nowadays. And this is what I am saying day by day in all my presentations, but this is the first time that I'm presenting this study. This presentation will be following Hippocrates' thought that said that foolish the doctor who despises the knowledge acquired by the ancient. For this reason, I will combine the reasoning used by Ayurvedic medicine that exists for more than 6,000 years with traditional Chinese medicine in this presentation. And also I will congratulate Hahnemann for discovering the homeopathy medication, and homeopathy is the medication of choice to be used nowadays due to the alteration in the energy pattern of all human bodies in this new global immune deficiency. To begin my presentation is that homeopathy, the people around the world use homeopathy. About 2 million people in this world, and in the United States, over 6 million people are using homeopathy. And antilipidemic drugs are used to reduce cholesterol, and the main reason is to reduce the chance to have myocardial infarction, to reduce the formation of cholesterol plaque in the blood vessels. And myocardial infarction usually has some blockage in the blood vessels, but nowadays we can see that there are patients that are having myocardial infarction without any arterial blockage. But this presentation I did in my last presentation, showing that the majority, there are some patients nowadays that are having myocardial infarction without any kind of arterial obstruction. And only to say that after the implementation of Flexner report in 1910, there were some alteration in the medical curriculum, and they considered only scientific what the pharmaceutical industry is producing for the treatment of majority of disease. And that is why I am saying that due to some alterations in the energy pattern of the human body for the last 10 or 11 years, these medical prescriptions should be altered due to these alterations that I will show to you throughout this presentation. And in this article that I published in 2021, I am saying that what Flexner report did in our medicine after 100 years of implantation, because Flexner considered scientific only what we can see by the naked eye or can prove by laboratory or radiological level. But what I want to say is that the human body is composed of energy, and this part is not studied by the medical faculties and by the modern Western medicine. So the part of energy is not studied by them. And this is the part that is altered in the last 10 or 11 years in this new global immune deficiency that I showed in other presentation. And all these alteration work is caused by the implementation of 4G and 5G technology and leading to alterations in the energy part of the human being in any country in this world, independent on the age group, independent on the type of diagnosis. And this is what I want to say, that we are facing a new global immune deficiency since 2014, 2015. And that's why we are facing increasing rate of some disease formations such as autism and increased rate of myocardial infarction among young people and other diseases such as cancer. And the majority of the people in this new global immune deficiency are having this energy alteration in the chakras energy centers. And this chakra is studied by Ayurvedic medicine, studied by Ayurvedic medicine, and this is the first chakra. This is the seventh chakra. The first corresponds to liver. There is a correlation of each chakra with one internal massive organs in traditional Chinese medicine. So This is the first corresponds to liver, the second corresponds to kidney, the third corresponds to heart, the fourth corresponds to lung, the fifth corresponds to spleen, and the sixth corresponds to the kidney, and the seventh corresponds to liver. In this study I did in my country, Brazil, I analyzed 1,000 patients from 2015 to 2020, and what I discovered in this research, that at that time before the COVID-19 pandemic, the 90% of all my patients were in this lowest level of energy in all these internal five massive organs. And if I measure the energy nowadays in 2025, the 100% of them are in this situation. And in this tree metaphor, I'm showing all my articles in all my presentations, showing the different viewpoints between Western and traditional Chinese medicine. In Western medicine, they are studying the part of this tree that are visible to the naked eye, and this part is what Western medicine is focusing their diagnosis and treatment. So each branch means one medical specialty, and each leaf means one symptom or disease treated by each medical specialty. And in this case, antilipidemic drugs are prescribed by general practice doctors or cardiology doctors to reduce the cholesterol. But in traditional Chinese medicine, all these problems in the leaf is not caused by the cause is not on the leaf. The cause is on the root of this tree, that traditional Chinese medicine is looking at the people in the part of energy and the part that is visible to the naked eye. And they also are including the external pathogenic factors as the factors that can begin the formation of some disease, such as cold, wind, heat, humidity, and dryness, leading to formation of this disease in the leaf level. What in all my presentation, I'm showing this history, but I will show to you another history. I will not repeat this history when I begin my reasoning, but I will show to you another history that I treated one specific patient in 2018, that she was a 70-year-old female patient that was suffering from diabetes, obesity, and had a recent diagnosis of malignant cancer, thyroid cancer. And after this diagnosis, she went to the doctor, and he said that she would be submitted to surgery in 2 months. And in this period, she went to my clinic to treat her anxiety and to prepare her to go to surgery. And after this treatment, doing Chinese dietary counseling, acupuncture, and replenishing the energy of all her organs, because all her internal five massive organs were in the lowest level of energy. And I began to replenish the energy of all her organs using the theory created by myself, titled Constitutional Homeopathy of the Five Elements, based on traditional Chinese medicine. And after this treatment, in these 2 months of treatment, the tumor that had 15 centimeters went to 3 centimeters, and she went to surgery. And in the surgery, the surgeon did the frozen biopsy, and what he could see that the malignant cancer disappear completely, and it was transformed to begin. And what I want to say in this case was that if we treat the root of this tree, we can treat all the patient's symptoms at the same time, including cancer. Cancer is a disease that do not have a cure in Western medicine perspective, but if we treat the root, we can treat all the patient's symptoms such as anxiety, depression, and in this case, I showed that even cancer could be cured. In the root of this tree, there are two theories, the yin and yang theory and the five-element theory. The five-element theory. Yin and yang are two theories that two energies that has inside our body that they need to be in a balanced state. When the patient has in energy deficiency, the patient has usually hot flashes and heat sensation. It's a symptom of menopause. And this is very common also in patients with diabetes. Patients with diabetes also have in energy deficiency, and also patients with all autoimmune disease also have in energy deficiency. And what I want, and young energy deficiency is when the patient has cold hands and cold feet. They usually have urinary incontinence, bladder prolapse, the rectum prolapse. And when we treat this condition, doing the reequilibrium of these energies, the patient could improve their symptoms without using any kind of surgery. And the second theory in this route is the five-element theory, that what I want to show to you. This is what the majority of patients nowadays has their deficiency in this five-element theory. The five elements corresponds to wood, fire, earth, metal, and water, and they have their representation inside the body, such as they are the liver, heart, spleen, lungs, and kidney. And in this research that I did in my clinic in Brazil, I showed that the majority of patients nowadays are in this lowest level of energy in these five internal massive organs. And this is the reason that we are facing this global immune deficiency, because the energy part is our immune system, preventing the formation of many kinds of disease, including myocardial infarction. The first theory is the yin and yang that has the symbol. Yang, this is yang, this is yin. They need to equilibrium, and they need to be in this equilibrium. And the disequilibrium between them can lead to formation of some disease in the leaf level. And this is the cornerstone of all treatments in traditional Chinese medicine. This is the main thing in this presentation that I want you to pay attention to, this schematic flowing of energy inside the body, of blood, yin and qi. And this is what we needed to treat in the majority of cases in all patients, dependent on the type of diagnosis. Because if we treat these energy alterations in this route, we can treat all the patient's symptoms at the same time. And blood is produced by the spleen, yin and yang is produced by the energy of the kidney, qi is produced by the lung and liver. And what I want to show to you is that when there is energy deficiency between one or a combination of energy deficiencies between these four energies, there is a formation of internal fire inside the body, leading to formation of symptoms. For example, indeficiency and formation of this internal fire is what all patients with diabetes is having in the root of this tree. And also energy deficiency in the root and formation of internal fire is what we can see in patients with cancer. And patients with autoimmune disease also have in energy deficiency and formation of this internal fire. And in this presentation, I would like to show two case reports of two patients that received antilipidemic drugs. And I want to show to you which was the energy alteration that they were presenting at the time of the medical prescription of these antilipidemic drugs. The first patient she lived in US, is a 65-year-old female patient that her cholesterol was 256 milligram per DL, and she was not presenting any problem, but her medical doctor prescribed atorvastatin. And this patient asked me if she could or not use this medication. And I asked her to do not use because she was in this energy deficiency situation. And what this medication could induce in this situation is what I want to show to you. And the second case report was a 75-year-old male patient that he had no complaints, and his cholesterol level was 125 milligram per DL, and his doctor prescribed preventatively simvastatin to prevent this cholesterol to be higher in the future. But this patient asked me if he could or not use this medication, and I asked him to do not use, because if he used this medication, he could have more possibility to have myocardial infarction, because his energy there he was presenting energy alteration in his chakras energy centers, and all of the chakras were in this lowest level of energy in these 5 internal massive organs. So all of them were using the 5 homeopathy medications in the theory created by myself, constitutional homeopathy of the 5 elements based on traditional Chinese medicine, to replenish the energy of these organs. To replenish the energy of the heart, I'm using sulfur, the spleen calcária carbônica, the lung silicia. To replenish the energy of kidney natrium muriaticum, and phosphorus I'm using for treatment of the wound. And also I orientate them to avoid the ingestion of some kinds of foods that could induce more energy imbalance of these 5 internal massive organs. To avoid the ingestion of dairy products, raw food, cold water, and sweets. To avoid the ingestion of this is to reduce the energy deficiency situation of the spleen pancreas, responsible for the formation of blood inside the body, and to avoid the ingestion of fried foods, eggs, honey, coconut, alcoholic beverages, and melted cheese, because all these food could induce more energy alterations in the liver and gallbladder and lead to more formation of internal fire, leading to complications such as anxiety, insomnia, and many other symptoms. And this is to avoid the ingestion of coffee, soda, and matcha tea, because all these drinks could reduce the energy of the kidney responsible for the production of yin and yang energy. And what I did in these patients were to did the apex bloodletting acupuncture to regulate the internal energy of the 5 internal massive organs, and to replenish the energy of all these chakras, all these organs, using homeopathy medications. This again to the medications to be used in this case, to tone the energy of all these organs, because the blood is produced by the spleen. You can see that the spleen were in this lowest level of energy. The yin and yang is produced by the kidney, but it was not working. And the chi is produced by the lung and liver that was in this lowest level of energy. And what we need to do in this case is to replenish the energy of all these organs to reduce the chance to have blood stagnation inside the blood vessels. Because if the patient has, sorry, this blood stagnation can lead to blood stagnation in the energy level. This blood stagnation can lead to formation of thrombosis of myocardial infarction if the blood stagnates inside the blood vessels. And why the antilipidemic drugs can induce more myocardial infarction in people nowadays with this energy deficiency situation? But because according to the Arnschutz law created in 1888 by two German researchers, they are saying that the use of any kind of high concentrated medication can induce more energy deficiency, and antilipidemic drugs, simvastatin or atorvastatin, is considered high concentrated medication and can reduce even more the energy of all these patients that are already very low, leading to toxic effect or lethal dose. The patient could die suddenly, have a sudden death using this kind of medication. For this reason, they use the medication of choice to be used in this new type of population that we are facing nowadays is a high diluted medication such as homeopathy medications. This is only to show that we are facing a new global immune deficiency. And this is another article showing the clinical characteristics of children in this new global immune deficiency. The babies and newborns that are born today, they are all having this energy deficiency situation. And this is a characteristic of adults in this new global immune deficiency. And this is the article that was published last month of this presentation, showing that antilipidemic drugs used in this population with energy deficiency situation can increase the chance to have myocardial infarction due to these energy alterations presented in these patients. And not only antilipidemic drugs, but any kind of medication, high concentrated medication that we are prescribing to treat the patients nowadays can induce myocardial infarction, such as antibiotic, antidepressant medication, antiglycemic, all kinds of medication. For this reason, this is the main reason that we need to disseminate globally, showing that the medication of choice to be used nowadays in this new type of population is the high diluted medication or homeopathy medication created by Hahnemann. This is another article published in 2020, written by myself, where I'm showing that all patients with history of myocardial infarction have in the background their energy deficiency alterations in the 5 internal massive organs. And this is another article showing that patients in the COVID-19 pandemic, when they were submitted to traditional medication with antibiotics and corticosteroids and etc., they could have more chance to have myocardial infarction without arterial obstruction due to these alterations in the energy level of all these patients because of these energy alterations that they were presenting. And also patients with congestive heart failure, they have these energy deficiencies that we need to treat this condition to give the condition to heart to come back the normal situation. And this is another article showing that the deficiency in the energy of the five internal mass organs or in the five the chakras energy centers are the main cause of the formation of myocardial infarction without arterial obstruction. And that is why I'm showing my last presentation, today's presentation, showing the homeopathy is a medication of choice to be used in the treatment of all kinds of disease nowadays due to this energy deficiency situation presented by the majority of patients globally. And also in the treatment and prevention of treatment of COVID-19 infection, the medication of choice to be used is a high diluted medication and not a high concentrate medication. And also in elderly patients, we need to use high diluted medication or homeopathy medications to do not cause more energy deficiency situation and induce more chance to have myocardial infarction. To finalize my presentation, I would like to say that in Brazil, homeopathy and acupuncture are considered medical specialties by the Federal Medical Council since 1980 and 1995. And I know that there are countries in this globe that are not considering them as medical specialties, but they are very important nowadays. They are very important tools to treat these a new type of population that we are facing, we are treating nowadays considered immune deficient. And to understand this study, we need to integrate the knowledge of Western and traditional Chinese medicine and also homeopathy created by Samuel Hahnemann. That is the main medication to be used in this new phase that we are living nowadays in this globe. According to Hippocrates, it's more important to know which person has a disease than to know which disease the person has. So, according to him, we need to treat the person and not the disease. Thank you for your attention. If you have any question, I will be very happy to answer you.
Yes, doctor, it's really a very good session. It is the time for discussion. Those who want to participate in discussion may please raise your hand. Dr. Ramprasad sir, have you heard the presentation?
Thank you, Dr. Dhanesh, and congratulations, Dr. Hong Wei Ling. Very nice presentation.
Thank you.
Acupuncture, theory of yang and yin, theory of yang and yin, and myocardial infarction disease, it and presentation, case presentation. Very nice presentation, empathic. Yang and yin, sulfur is a fire. According to presentation, sulfur is a fire, calcarea car is a earth. Calcarea car medicine, homeopathic medicine, earth, and natrum is a water. Sodium chloride is a water, and silesia just like wood. So very nice, excellent presentation.
Thank
Very,
you.
very thanks. Very, very thanks. Thank you.
This is the main reason that we need to use nowadays. We need to present all this study to show to the world that we cannot use any kind of high concentrated medication anymore. This is why we need to use all these presentations and all these articles to show that we need to use only homeopathy nowadays.
Exactly, we need this kind of presentations to understand what is the relevance of eye systems in treating the lipidemia and whether there is any complication thereafter with the right system of treatment. Frankly, there will not be any complication, and you will be able to prevent the so-called myocardial infarction as well as other conditions that may arise as a result of increased lipid profile conditions. What kind
Yeah,
of what kind of food do you?
they have some questions here. I saw. Oh, can I answer? About this homeopathy medication to deposit fat below the lower eyelids, I usually use the replenishment of all the energy of all these organs, and the symptoms of this deposition in the eyelid will improve very much. And you needed to use these 5 homeopathy medications to treat this energy deficiency, and the symptom will improve. Okay, Dr. Kumari. I don't know, you can have another homeopathy medication, but I don't have this I, um
What what
I-
kind of food restrictions you used to give? Uh, is there any food restriction when the patient is under treatment?
yeah. Yeah, I usually combine the Chinese dietary counseling and the acupuncture with homeopathy medication. I think in 3 months of treatment, it can improve very much. Okay.
Uh, what is the impact of food that is people used to take a late supper, and what will be the implication of the same in lipid profile?
Implication of?
This there are people used to take a supper very lately. That means they used to eat very late suppers, and we know that the energy is not being used when you take this food at the late hours, particularly about 11 a.m., 11 p.m. or 11 midnight, 12 midnight, like that. People used to take heavy food, and that is being not used being that is not being used by the body, since there is no energy requirement by the time, then that may be the reason why the lipid profile may be much higher in those people.
I don't understand, Dr. Danesh.
Yes, I
Yeah,
usually
it's very low. I cannot hear what you're saying.
we used to say that food is for energy, and
Energy, yeah.
the person we used to use our energy during daytime and not at time. At night we don't have required so much of energy, but still people used to take heavy supper, and as a result of that, the fat increase in the body, fat content in the body will be much higher than what is expected to be. In those conditions, if you look at the blood picture, you can see that the heavy rise in cholesterol level. And as we all know that the 80% of the cholesterol is being produced by the liver itself. So whether it is a positive development or a negative development, according to you? Liver is producing the more 80%. So if you have a person who is coming up with a cholesterol level of 3,000, no, 300, then that means 260 out of this 300 is being produced by the liver. So it is a positive is this a positive aspect or a negative aspect? our body never produce anything in excess unless otherwise there is a disease. But a normal liver used to produce this much of cholesterol, and we all know that cholesterol is one of the things that is required for the elasticity of muscles, and if the cholesterol level is so low, the elasticity of the muscles will be weaker, and as a result, you may not be able to walk in a proper way. Can you follow me?
Dr. Bob, do you want to ask anything?
Yes, Dr. Bob.
Doctor.
Dr. Bob,
Sorry.
You can
Yeah.
speak. You speak now.
Because the voice is not very clear. This maybe of the internet interruption or what. Can you hear me?
Yes?
Is it clear? Because Dr. Dadesh's voice is breaking. You see, I cannot hear him that clearly now.
It may be
So-
my network is quite weak. That may be the reason why you're not able to hear properly.
Maybe it's the technical thing. Yeah. Actually, when I think of acupuncture and traditional Chinese medicine, I have come across it with my godfather. He's a homeopath at the same time also as an acupuncturist. So they all goes along together. Then and regarding this thing about this what hyperlipidemic or the anti-cholesterol pills that be taken by Dr. Huan mentioned, I think it does affect the liver, you know, just like the liver function is to manage the cholesterol, but we try to teach the liver not to do its function by taking all these anti-cholesterol tablets in our body. So in the end, the liver might protest and refuse to function anymore. So the long term of taking, and because of this, it will have some other side effect in other areas, like what she mentions about infarction, myocardial infarction, all these things. So it is the many factors that group together that cause this type of condition. And one of the factors is what Dr. Huan says. And I would like to congratulate Dr. Huan for all his research papers that she has written and has shown just now. And also regarding the meridian point that is in the TCM and the chakra point, which is in the yoga, right? Yoga meditation, they are really connected, similar, like homeopathy, similar and similar. So we can coordinate and get along with this chakra, meridian point, and homeopathy. And like what she mentions, the chakra point at the top one is wood, based on the meridian point. So wood base is connected with the liver, and that's where the meridian point is, and that meridian point controls the gallbladder and the liver. So whenever someone they sleep very late or lack of sleep, that would affect their liver function and also their cholesterol balance in the body. So this is true. Okay? So I agree with Dr. Huan's research and statement just now. So thank you, Dr. Huan. So we use in homeopathy, usually we use chelidonium, which is a very good remedy, a liver remedy, and it will help to reduce the cholesterol. And also for the heart problem, we use Crataegus. Okay, thank you.
But what I want to say is that even you are using homeopathy to treat the leaf, the cholesterol, high cholesterol is the leaf. you need to treat the root also to improve the energy of the entire patient. Because if you treat only the symptom, the patient would be weak in energy, and you need to treat the symptom and the root also.
So you use acupuncture point treatment or what?
Yes, I
To
use
to
auricular acupuncture and acupuncture also.
to remove the blockage in the meridian point of the gallbladder and the liver meridian, right?
Now, the intention of acupuncture is to regulate that for energies also, to regulate the production of blood, yin, yang, and qi, and take out the heat. Only using this reasoning, I can treat all the patient's condition with the same method.
Recently, I heard that someone they use the acupuncture needle, they dip it into homeopathic medicine and apply it on the meridian point. Are you doing that too? Have you tried that? You you use acupuncture and by using homeopathy medicine in the liquid form, you dip it, then you poke it on the meridian point where you want to use it. Have you heard about that?
Acupuncture with homeopathy.
Yes.
Oh, no, I don't use this kind of. I heard, but I didn't try it.
Because my godfather tried that. He said it's very effective sometimes, you know.
Yeah?
Straight away
Okay.
he goes to
You
the
need to
point.
bring this to us to learn how you can use. Okay. Thank you.
Okay. Dr. Ambaresh sir, what's your opinion on all these things?
Hello. Hello.
Yes.
Cholesterol diet, black seed, black seed, black seed, Hindi TC, the very good diet for cholesterol.
Oh, bless you.
Cholesterol and homeopathic medicine, Delipodium, Lycopodium, etc. and Calcarea floor, Thuda. Thuda is a very good remedy for the cholesterol. Cholesterol. Thank you.
There is a big announcement for all of you from IFPH. You know that tomorrow we are celebrating the 1800 day here in this platform from 8:30 to 9:30. Doctors and eminent personalities from different parts of the world are participating, and the inaugural ceremony will be done by Dr. Manju from National Council of Homeopathy. And on September 28th, we have a big day. That is the 5th year anniversary of IFPH being celebrated in Cochin Taj Hotel, and where we will be meeting one by one in the session. You can have it, we will have interactive session as well as time for discussion, and all those things will be arranged, and we will be felicitating our guests of honors to the faculties who had done sessions in our forum also. So there will be some cultural programs at the end. Hope all of you will be joining us for the functions, and the registration fee for that is rupees 3,000 Indian dollars and 2,000 no Indian rupees, and $200 per foreign delegates. Hope all of you will be attending with great happiness in this session. We invite all of you to join us on the same venture. Dr. Bob, are you ready to come over to India and celebrate the 5th anniversary here in Kerala? Question.
This
I
year
I
I
was,
cannot go, but
but another state at that time, that period very busy, right up. So, in fact, I haven't done all my international passport yet. So I'm just doing the local passport only in Malay, in the East West Malaysia, in East Malaysia. So, but I will encourage my people like if I can make it, it will be a bonus. Because I haven't done a lot of this paperwork yet. So, but I just draft up the budget for this one for the international participant. So if there any feedback, I will let you know. If they are coming, any of them. Thank you very much.
Dr. Hong Wei Long, whether you are interested in coming out to India, we want to
this
see
year I
you.
cannot go, sorry. But perhaps in another year I can go. You
we,
need to invite 1 year before
we really likes
you,
to have you people here in Cochin with us.
yeah, to need to prepare to go. 1 month to prepare to go is very difficult.
No, it's a very short time for you to prepare.
Okay, okay.
Okay. Dr. Habibullah, do you want to speak? If you are interested in speaking, please open up now. Is there anyone, if anyone want to talk to Dr. Huang Wei Liang, we may please raise your hand so that we will allow you to talk to Dr. Hu. Nobody is it. Doctor, what is your success rate with this kind of treatment? Not only
Yes,
in all aspect.
using this theory that I created.
Yes.
Yes, in the majority of patients nowadays, I'm using to improve their immune system. And this is to prevent the formation of myocardial infarction, diabetes, hypertension, and even cancer nowadays, because all these chronic disease came from this energy deficiency situation. And only patients with fever or some infectious disease that is acute disease, you need to treat the acute phase, and then you need to treat what has in their background, that is this energy deficiency situation. Okay? And this is very I am treating the majority of patients, and this treatment can rejuvenate and can prevent how can I say, to become old and to prevent so many disease. That's why this is very important nowadays, to be strong and to
Okay.
treat all these conditions also. We can treat all these conditions only using these 5 homeopathy medications.
Okay, now I invite Dr. Bob to say a vote of thanks to the session.
Okay, thank you. Bye-bye.
On behalf of the International Forum for Promoting Homeopathy, I would like to congratulate and express our sincere thanks to Dr. Juan Wei Ling of Brazil for successfully conducting the 1799 International Webinar and Uninterrupted Webinar on this day, 4th August 2025. Once again, thank you very much, Dr. Huang Wei Ling from Brazil, and we hope to hear from you again. Over to you, Dr. Danesh.
Thank you, Dr. Bob Lim. Thank you, Dr. Huang Wei Liang, and those who attend the session in this evening. Tomorrow, as you know, that we are celebrating the 1800th day from 8:30 to 9:30 in international session. So hope all of you will be joining us tomorrow at the same time. Thank you all. Thank you, Dr. Huang Wei Liang, once again. Bye-bye.